Hi everyone, welcome to Ace Anatomy. The human skull is like a well-designed maze filled with tiny passageways called foramina. But what do they do and why are they so important? In this video, I will break down the key foramina of the skull, what passes through them and how to remember them easily. Are you ready? Let's dive in and make skull anatomy simple and unforgettable. Today we shall explore some of the foramina present in the anterior, middle and posterior cranial fossa. The foramen cecum is situated between the crista galli and the crest of the frontal bone. This is the crest and this is the crista galli. So it is usually blind, but sometimes it may transmit the emissary vein from the nasal cavity towards the superior sagittal sinus. To remember, you can say cecum secret escape. So S is for the superior sagittal sinus and the E in the escape is for emissary vein. The cribriform plate is a sieve-like perforated bony plate lying on each side of the crista galli. So here 15 to 20 filaments of olfactory nerves pass through. To remember, you can remember the mnemonic only odors, since olfactory nerve carries the sense of smell. The anterior ethmoidal canal, it opens in the cribrofrontal suture behind the crista galli. Here the anterior ethmoidal nerves and vessels pass. To remember this, you can remember as nerves, arteries and veins enter anteriorly. The posterior ethmoidal canal is present in the posterolateral corner of the cribriform plate. So it transmits the posterior ethmoidal vessels and nerves. So you can remember as nerves, arteries and veins enter posteriorly. The optic canal connects the middle cranial fossa with the orbit. So it is bounded by anterior and posterior roots of lesser vein and the body of the sphenoid bone. So it transmits the optic nerve with its meningeal coverings, the ophthalmic artery with its sympathetic nerve plexus. To remember, you can remember the mnemonic only optics, since both the structures supply the eyeball. The superior orbital fissure is a triangular fissure connecting the lateral portion of the middle cranial fossa with the orbit. It is bounded above by the lesser wing of sphenoid, below by the greater wing and medially by the body of the sphenoid. The common tendinous ring of Zinn, it divides this superior orbital fissure into three parts, that is lateral, middle and a medial part. So the structures passing through it are, from the lateral part, through the lateral part we have the lacrimal nerve, the frontal nerve, trochlear nerve, superior ophthalmic vein, meningeal branch of lacrimal artery and orbital branch of middle meningeal artery. In the middle part we have the upper and lower divisions of oculomotor nerve, nasociliary nerve, abducens nerve, and in the medial part we have the inferior ophthalmic vein and the sympathetic twigs from the internal carotid sympathetic plexus. So to remember the structures passing through, mainly the nerves, you can remember it as live frankly to see no insult and success often. So L is the lacrimal nerve, F is frontal nerve, T is trochlear nerve, S is superior division of oculomotor, N is nasociliary, I is inferior division of oculomotor nerve, and A is for abducens, S is for the sympathetic nerves, and O is for the ophthalmic vein. The foramen rotundum is present in the greater wing of the sphenoid. It is located just below and medial to the superior orbital fissure. So it leads forward into the pterygopalatine fossa. It transmits the maxillary nerve. To remember, you can remember rotund max. Rotund means round. The foramen ovale is located posterolateral to the foramen rotundum. It leads inferiorly into the infratemporal fossa. It transmits the mandibular nerve, the accessory meningeal artery, lesser petrosal nerve and emissary vein. You can remember this as ovale makes a large exit. Ovale is the foramen, M is mandibular nerve, A accessory meningeal artery, L is lesser petrosal, E is emissary vein. The foramen of Vesalius is a inconstant foramen. When present, it is located between the foramen rotundum and foramen ovale. It transmits the emissary vein connecting the cavernous sinus and the pterygoid venous plexus. So you can remember it as very veiny. Foramen lacerum is a foramen with irregular margins between the sphenoid and the apex of the petrous temporal bone. The carotid and the pterygoid canals, they open into it. So here only two structures pass, that is the meningeal branch of ascending meningeal artery and an emissary vein. The internal carotid artery, it traverses in its upper part, and the nerve of the pterygoid canal, which is otherwise known as the Vidian nerve, is formed in its upper part by the union of greater superficial petrosal and deep petrosal nerves. So since this internal carotid artery and nerve of pterygoid canal is important here, we can remember the mnemonic I need exit. I is for internal carotid, N is nerve of the pterygoid canal, and E is the emissary vein. The foramen spinosum is situated posterolateral to the foramen ovale. It leads inferiorly into the infratemporal fossa. So it transmits the middle meningeal artery, the parietal trunk of middle meningeal vein, and the meningeal branch of mandibular nerve, which is otherwise known as nervus spinosus. To remember, many men munch. So M is for middle meningeal artery, middle meningeal vein, and other M is for the meningeal branch of mandibular nerve. The carotid canal. So through this carotid canal, the internal carotid artery with its periarterial sympathetic plexus pass through. So you can remember it as intense pressure. Intense pressure because the blood will be under high pressure there. And I is for internal carotid, P is for the periarterial sympathetic plexus. The internal acoustic meatus is present in the center of the posterior surface of the petrous temporal bone. It is about 1 cm in length and it transmits the facial nerve, the vestibulocochlear nerve or acoustic nerve, and the labyrinthine vessels. So to remember, funky acoustic lab, facial nerve, F is for the facial nerve, A is for the acoustic nerves, and L lab, that is for the labyrinthine vessels. The jugular foramen is located at the posterior end of the petro-occipital fissure. It is an interosseous foramen situated between the anterior margin of jugular process of occipital bone and posterior margin of the petrous part of temporal bone. It is divided into anterior, middle and posterior parts. Through its anterior part, we have the inferior petrosal sinus and the meningeal branch of ascending pharyngeal artery, which passes. In the middle part, we have the 9th, 10th and 11th cranial nerves, and in the posterior part, we have the sigmoid sinus and the meningeal branch of occipital artery. So to remember the important structures which pass through the jugular foramen, remember I go vagus again. I is for internal jugular vein, which the sigmoid sinus actually continues as the internal jugular vein, and so you can also remember the inferior petrosal sinus. G is for the glossopharyngeal, that is the 9th cranial nerve. Vagus is for the vagus nerve 10th, and 11th cranial nerve, that is A accessory nerve. The internal opening of this hypoglossal canal is located just above the tubercle for alar ligaments on the medial aspect of the occipital condyle. It transmits the hypoglossal nerve, the meningeal branch of ascending pharyngeal artery and emissary vein from the basilar venous plexus. You can remember the mnemonic huge tongue, since the main structure which passes, that is the hypoglossal nerve, supplies the muscles of the tongue. The foramen magnum is the largest foramen in the skull. It is located in the floor of the posterior cranial fossa. This foramen we divide into smaller anterior part and a larger posterior part. So in the anterior part, we have the apical ligament of Dens, the superior longitudinal band of cruciform ligament and the membrana tectoria cast. In the posterior part, we have the structures passing through, that is the medulla oblongata, the meninges, the meningeal branch of upper cervical nerve, the vertebral arteries, the sympathetic plexus around the vertebral arteries, anterior and posterior spinal arteries, and spinal root of accessory nerve. To remember, you can remember the mnemonic, magical magma, volcano always pours smoke. So this is to remember the main structures, that is medulla oblongata, the meninges, the vertebral artery, the anterior spinal artery, the posterior spinal artery, and the spinal root of accessory nerve. And that wraps our journey through the foramina seen in the interior of skull. These tiny openings may seem small, but they play a huge role in neuroanatomy and in clinical practice. Focus on their locations, what passes through them, and the clinical relevance. It will make all the difference. If you found this video helpful, hit like, subscribe, and turn on notifications for more anatomy insights. Have any questions? Drop them in the comments. See you in the next one.